When we talk about things like Kraft prediabetes profile, viewers, subscribers write in and they say, you know what, I found out that I have not only insulin resistance, but a full-blown diabetes. I did that OGTT, or the insulin survey that you recommended. But my doctor's been telling me I'm fine. Why doesn't my doctor know this? Well, I hear that question a lot. You see that question a good bit in terms of our comments. Here's the thing. If you take a look at the primary care physician's knowledge and practices and perceptions on prediabetes, it's not a pretty picture. Now, this study was done, for example, it was published in 2019 in the Journal of General Internal Medicine in September. So it was just very recent. As you can see from here, it's a national survey of primary care physicians' knowledge, practices, perceptions, prediabetes, and it's my old homies, my friends back at Johns Hopkins. And so here's the issue. Despite strong evidence and national policy supporting type 2 diabetes prevention, very little is known about type 2 diabetes prevention in the primary care setting. And here's the thing. It's not pretty. So here's some of the things they found. For example, only 33% of eligible participant physicians, primary care physicians, even returned the survey. Of that group, only 36% said they even refer a patient for lifestyle change program. So you could say, well, maybe the primary care physician is doing the lifestyle change program with the patient. Okay, let's think about this. What's the average time that a physician spends with a patient? 7 minutes. Lifestyle change program doesn't fit. 43% do discuss starting metformin for prediabetes. They didn't ask how many start metformin for longevity. They didn't ask how many do OGTT. They didn't ask how many do an insulin survey. Now let's ask the physician. They did ask the physicians though, why do the physicians think that this is a problem? The physicians acknowledge it's a problem, but they said, you know what? The patients really aren't motivated. They also said there's some insurance issues as well. Now, before you throw too many stones at the physicians, they're right on both parts. The vast majority of patients really aren't motivated, and insurance companies don't pay for this kind of stuff. So there are problems all around. Let's take responsibility for what we can do and get it done. Thank you for your interest. I've had so many patients come to me because they quote their doc, here, why don't you take this statin and let's see what happens. What? Let's see if a heart attack or stroke happens? No. Prevention is a science. We know what's going to happen. We know what to look for. We know how to prevent it. Come see us in Louisville on November 8th and 9th. Get your CIMT, artery scan, all your labs, see me, and spend 2 days learning, usually what your doctor doesn't know yet about the science of prevention. Look forward to seeing you there. Thanks.